A 28-year-old man is brought to the emergency department after a witnessed seizure. Upon regaining consciousness, he complains of severe pain in his right shoulder. On examination, the shoulder appears flattened anteriorly, and the arm is held in adduction and internal rotation. The patient is unable to externally rotate the arm. X-rays of the shoulder reveal a loss of the normal relationship between the humeral head and glenoid, with the humeral head in internal rotation. Which of the following is the most likely diagnosis? A. Anterior shoulder dislocation. B. Clavicle fracture. C. Acromioclavicular joint dislocation. D. Posterior shoulder dislocation. E. Rotator cuff tear. Before going forward, please pause and write your answer in the comments. Now let's find out the correct answer. Answer: D. Posterior shoulder dislocation. Explanation: the patient's clinical presentation, including the arm being held in adduction and internal rotation, along with a flattened anterior shoulder, is highly suggestive of a posterior shoulder dislocation. This type of dislocation can occur due to violent muscle contractions, such as those experienced during a seizure or electrocution injury. X-rays typically show a loss of the normal alignment between the humeral head and glenoid, with the humeral head appearing internally rotated. Posterior shoulder dislocations are less common than anterior dislocations and can be missed if not carefully evaluated. Most posterior dislocations are managed with closed reduction under sedation, but this must be confirmed and managed by the appropriate orthopedic intervention. The other options, anterior shoulder dislocation, clavicle fracture, acromioclavicular joint dislocation, and rotator cuff tear, do not match the specific clinical features and X-ray findings described. Key takeaway: posterior shoulder dislocations should be suspected in patients presenting with shoulder pain after violent muscle contractions, particularly when the arm is held in adduction and internal rotation with characteristic X-ray findings. Proper identification is crucial for appropriate management, typically with closed reduction. If you loved this video, please like and hit the subscribe button. We will keep uploading new questions on a regular basis.